Hey, this is Jeremy, and today we're going to be talking about professionalism. Now, professionalism is how you're expected to act as a member of your profession. Now, a profession, that's an area of study or field of study that's going to require a very specialized set of skills and knowledge that's going to be associated with that field of study. Now, our profession, that's going to be emergency medicine or paramedicine, and that's where our specialized set of skills and knowledge comes in at. And with that specialized set of skills and knowledge, you're expected to act a certain way. You're expected to perform a certain way, to maintain a standard that our peers are all there with. Okay, and there's a couple different things that we do to hold each other accountable, and that is with licensure and certifications and maintaining our continuing education. And that's going to be part of those minimum standards that we all hold each other to. So we also expect each other to provide quality patient care, and that's going to go with maintaining that continuing education. If you have somebody that's performing the procedures 20 years ago, or that they were performing 20 years ago today, well, that's a little different. So, for example, ACLS. ACLS has changed a lot over the years. If you have come across somebody that's doing things from 10, 15, 20 years ago, it's not necessarily holding each other to a standard. That's why we do ACLS classes, and we need to renew it every 2 years, or do CPR, those CPR classes. It's to maintain a current set of knowledge on medicine, or on emergency medicine specifically, that we've established through research and practice and evidence-based practice. And that's what we do. And we need to instill pride and maintain a high standard in our profession. Okay, you need to be holding each other accountable. Make sure that you are doing the things that you're supposed to be doing, including your paperwork, treating your patients right. Now, there's a couple different attributes of professionalism that you'll see on test questions and that you may be asked about. And to name a few, there's integrity, empathy, confidence, self-motivation, communication, teamwork, and patient advocacy, just to name a few. So, in really understanding how they all fit together is going to go with how you understand yourself, your place in this profession. Now, integrity is one of the most important ones, and that's honesty. That's being honest with yourself, being honest with your patient, being honest with your peers, and documenting things factually. And that's being honest. That's going to help you hold yourself accountable. That's going to help you hold others accountable for their actions. If you make a mistake or you do something incorrectly, that's okay. We can learn from that. But if you don't own up to the mistake, you don't even necessarily believe that you made a mistake, that's not necessarily the best way to go about it. Because if you own up to your mistakes, you can learn from it, and others can learn from your mistakes. Why should somebody else have to learn something the hard way that you've already learned for them? And that's going to be part of that integrity, and it's going to go with communications as well. We also need to be empathetic. We need to be empathetic towards our patients, their families, each other. And that empathy is just showing compassion. And it's not necessarily saying that you know how somebody feels, but it's understanding that they're feeling something. They're feeling a certain way. For example, if we go to a pediatric cardiac arrest, which that's one of the most high stress, high emotion situations that we'll ever be in. So the parents, be empathetic towards them, because they may have witnessed their child go unresponsive and witnessed their child go into cardiac arrest, and they may have performed chest compressions for 5-10 minutes before you ever even got there. So show them some empathy, show them a little bit of compassion about where they're coming from, what it is that they have. Your partner or the fire crew or any other responder there, is this their first arrest? Is this their first time being in this situation? Show them a little compassion, because they may be a little frazzled. They may not necessarily be performing to the standard that you need to, and that's going to go with that communication and teamwork. You need to be able to communicate freely and be honest with them. Say, hey, I understand this is stressful, but I need you to do a job right now, and this is what I need your help with. and help guide them. Okay, especially if this isn't going to be your first rodeo. So that's going to go with that empathy, that communication. Now, there's lots of self-motivation that goes with this as well. You have to maintain your skills, maintain your knowledge base, understanding that, a couple years ago, having an O2 saturation of 100%, that was ideal, that was okay. But now we know that 94 to 99% for your SpO2 is the way to go. That way, we're not causing oxygen toxicity. Or causing peripheral or cerebral vasoconstriction or myocardial ischemia to get worse due to the potential vasoconstriction. And that's going to go with the confidence in your skills, the confidence in your knowledge through your self-motivation of self-study or attending extra courses. Those are things that are really important, especially in our area of study, our profession, because things are always changing in medicine. That's why they call it a practice, where our physicians practice medicine, because things change, and they change their practice with the way that they see the research that gets done. Now, we do need to communicate and be empathetic towards your partner if they do have that rough call, like what we were speaking. Be respectful, share ideas, share coping mechanisms, and teamwork is required. You do need to be flexible and maintain that standard that they're expected to maintain their skill set at, or the way that they're supposed to act on scene with the family, with the patient themselves, or with the other providers such as the fire, police, and the hospital staff. We also need to be patient advocates in this profession, and that means at the end of the day we need to do or at least educate the patient on what may potentially be best for them. If you have somebody with a femur fracture or a pelvic fracture that based off your physical assessment, and you think that they may need to go to a trauma center that's 45-50 minutes away versus the hospital that's 10-15 minutes away, do you really think that's going to benefit them? If so, explain the risk and the benefits of going to the hospital that's closest or going to the hospital that's further away. And you can explain those risks to the family as well, but ensure not to violate HIPAA or anything like that. And so if you're advocating for your patient, you're doing the best for your patient at the end of the day. There's not going to be anybody that's going to fault you, and your patients are going to benefit from it. Their outcomes are going to be better. They may have a better standard of living after they recover from their ailment, and that's going to be life-changing. And that's what our profession is about. We have a direct impact on patient lives. We are brought into these homes and these situations on potentially the worst day of their life, and we're expected to at least start making the change right there. They expect you to act a certain way. They expect you to have a certain skill set, a certain set of knowledge that they may not necessarily know what that knowledge is, but they expect you to know it, and they expect you to be able to perform. So maintain your mental fortitude, maintain your physical fitness, and that's all going to be part of professionalism and how we're perceived. So at the end of the day, professionalism, it's the way that we act, it's the way that we're expected to act, and it's the standard at which we hold ourselves and our peers to. And that's the real big takeaways of professionalism.